I grew up in Dubai in the United Arab Emirates. My family's from Egypt, from Cairo. I went to medical school in Doha in Qatar at Cornell, and then moved to the U.S. in 2012, where I did my residency training at Johns Hopkins. At the end of my residency, I was asked to serve as a chief resident in our internal medicine residency training program. So I did that for a year, and then moved to Cleveland, Ohio, where I did my cardiology training, electrophysiology training, and then stayed on the faculty for a little over 4.5 years, and moved to Nashville, Tennessee after that. Electrophysiology is really a fascinating field. I think I'm blessed to be able to practice it every day, both from an intellectual and technical standpoint, but also really for the amount of good we're able to do our patients. It's really a specialty where you take care of patients who are otherwise healthy but have abnormal heart rhythms for some reason, but also really sick patients. And it's an opportunity for us to make a difference where we can save lives, cure conditions with catheter ablation, and have patients live longer with treatments like defibrillators and pacemakers. So a lot of patients come in and see a general cardiologist for a variety of conditions. One of the most common conditions that we see nowadays, particularly in the era of wearable devices and smartwatches, is atrial fibrillation. So they might complain about palpitations or a feeling of an irregular heartbeat. Sometimes symptoms can be like shortness of breath or tiredness. And then we find that they have an abnormal heart rhythm. That's when patients end up in my office. Another common scenario, frankly, and this is a passion area of mine, is patients with heart failure, where they have a weak heart muscle. Oftentimes that could be related to an arrhythmia, but even if it isn't, it's important for them to see an electrophysiologist because oftentimes patients with a low heart pump function are candidates for a defibrillator to prevent them from having heart rhythms that would otherwise claim their life or have them pass out. In electrophysiology, some of the most common procedures right now are catheter ablations. The conditions we do that for are things like atrial fibrillation, SVT, so that's short for supraventricular tachycardia. Those are rapid heart rhythms from the top chambers of the heart, but also premature ventricular contractions and ventricular tachycardia. Those are rhythms from the lower chambers of the heart. Additionally, we implant pacemakers and defibrillators, as well as devices to occlude the left atrial appendage. And so really quite a broad spectrum of procedures for patients with heart rhythm disturbances. Most patients that end up in my office have some degree of abnormal heart rhythm or a weak heart muscle. They're fairly symptomatic. They don't feel well. This is impacting their quality of life. And so I think for most of my patients, really, they want to be listened to. They want to be heard. They want to understand that their concerns and their symptoms have something that we can offer to help with. And so really, I think that matching the right patient with the right intervention, or really no intervention at all, is how I view my practice. The most rewarding part of our field and our practice is being able to intervene with the procedure, get rid of a patient's arrhythmia, and then see them back in follow-up and see how great they're doing and how much of a quality of life they've had as far as an upgrade. As much transparency as possible with just the logistics of the day. I find that that's what most patients end up being anxious about. So I talk to them about expectations, when to come into the hospital, what the day is going to look like, what the procedure entails. And I find that if they're really well informed about how the procedure is going to go, what to expect if they need to stay in the hospital for a night or two of monitoring, most patients do very well and their anxiety is well addressed. When a patient comes to see me in my clinic, I hope that they can sense that I've spent a fair amount of time making sure that we've thoroughly reviewed their chart, reviewed their history, listened to their history, and come up with a personalized and tailored treatment plan to get them better than when they first established care with me. I feel very blessed that Centennial Heart is a cardiology practice with a lot of breadth and depth of talent. We're so spoiled that any time of day I can pick up the phone and call a heart failure cardiologist, an interventionalist, an ICU doctor, a general cardiologist, and feel like my patients are going to get the best service and the best care from really expert cardiologists that are top-notch anywhere in the world. I'm Shady Nakhla. I'm an electrophysiologist practicing at Centennial Heart in Nashville, Tennessee.